what we are talking today about is the mucositis. And everybody of us will remember the nice talk by Professor Armand, who told us the new developments in cancer treatment. And it's really exciting what cancer treatment is going to do nowadays. If I do remember when I was a young medical student, about 15 to 20% of cancer patients would survive. Nowadays, about 30 to 40% of cancer patients will survive. Though in these last 30 years, there had been a great success being done. And I think everybody of us can be proud in that, and we can feel very happy about that. Nevertheless, Professor Armand told us that everything has its price. So when you have cancer treatment, you have side effects, unfortunately. And patients really have to suffer from these side effects. And the topic I'm going to talk about now is the oral mucositis, mucite orale. So you might say, well, what's the problem with it? In fact, it is a problem. If we look at our patients, we do see those ulcerations. And you see the inside of the cheek. This is a patient undergoing radiotherapy. And everybody of us who ever had an inflammation in the mouth will know that it is really unpleasant. You cannot eat anything. It just hurts. And even if you talk, whenever your cheek is touching the teeth, it hurts. And life quality is really going down. Though this is a topic we're talking about. Just another picture. A large ulcer. And imagine this patient, he really cannot eat. He has no pleasure anymore. And eating is one of the real important things in life. It's nice to have a drink. I was out yesterday and had this wonderful, lovely Southern France rosé. You won't like that if you have a mouth like that. And we had been eating just beautiful barbe yesterday. But again, you won't like the fish if you have a mouth like that. And most of our patients undergoing chemotherapy or radiotherapy will develop this kind of mucositis. So today we are here to talk about a very old substance, clonidine. Clonidine is known since the mid-70s. When I was a medical student, it was one of the pharmaceutical drugs that we used to treat hypertension. Very effective, actually. It is working on the alpha-2 and alpha-1 receptors in the midbrain and works quite well. I even do remember my grandfather was treated with clonidine and it was quite well, and he became 92 years old. So apparently it was an effective drug. The nice thing is we have a lot of experience with this drug in hypertension, of course, and we do know exactly all the side effects of this substance. And the nice third thing is that the good guy who invented all us was a lazy guy. He never did things twice. So when he was producing alpha-1 and alpha-2 receptors on neuronal cells, he said, well, it might make sense to have those receptors as well on inflammatory cells, on macrophages or on leukocytes. And in fact, the alpha-2 receptors are expressed in the immune system cells as well. And if you do go ahead and treat with clonidine the macrophages and the leukocytes, you will have an inhibition of IL-1 beta, of IL-6, and of TNF-alpha. You do remember one of those cartoons I showed you just at the beginning? Those were the key regulators of inflammation. So when you decrease the key regulators of inflammation, you would expect that inflammation will not as be pronounced as without inhibition. And additionally to that, if you do give clonidine to these cells, you stimulate TGF-beta production, and TGF-beta is an anti-inflammatory agent. So all this lumped together makes us suggestive that with clonidine you might reduce the inflammatory activity.